My name is Joshua Bowen. I'm an RN, and I am a surgery nurse mainly. I do work a little bit on the floor, acute med-surg floor as well. My wife and I always knew that we were probably going to come back to a small town, especially, our hometown where all our family is. And with my wife going to school in Colorado, we got to learn a lot of things with the big hospitals and the patient care, how different it is from the big city to a small town. And that's one of the reasons we wanted to come back home, was because we had confidence on our small hospital. We wanted to make a difference together. So I do a little bit of outpatient work as well, because we're a small rural hospital. We kind of have to be diverse in doing a little bit of everything. So I work in outpatient and surgery. I really like it because I'm able to help admit the patients beforehand, and then I'm able to recover them once their surgery is over. When I'm back in OR, I'm starting to learn to scrub in a lot more cases. I do a lot of circulating, and that's been a big challenge for me. So that's kind of the big difference between outpatient and surgery, is being able to work side by side with the doctors and doing those kinds of things. I think the nursing staff and physician staff is one of the greatest, that I have been around. We're able to have confidence in calling all of our doctors depending on who's on call. A lot of them are able to come in. They live real close by, so we know if we need them, they can be here real quick. So that's one thing we have a lot of confidence in our doctors is, depending on which one's on call, they'll always be there for us. So I feel like I have a lot of encouragement by being able to see new young doctors come into this facility, and the way that the community and the hospital and the clinic has been able to kind of grow them into being a family physician, a true family physician. It depends on your doctors that have been here for a number of years. You look to them, and I know the young doctors like to do that. They want to build that relationship with that doctor. And of course the staff here is always welcoming. We have med students that come all the time, and they feel really comfortable by the time at the end of their rotation here. So it's just a matter of building relationships with them and building confidence in that doctor and growing in a small community. Our community will be able to give back to that physician or young physician that's coming out of school. Just build confidence with our patients and our staff. And we have a lot of experience at this hospital. There's not that much turnover. We have a lot of staff that's been here for a number of years. We just had a gal back in surgery who just retired after 43 years of service. So she pretty much saw her share of physicians and nurses and doctors come. So it just goes to show you that even in a small town, you can build a pretty good career in a hospital. So.